I now have the honor to give the floor to Dr. Olushayo Olu. He is from the World Health Organization. He serves there as the focal point for disaster preparedness and response for Eastern and Southern Africa. Please.
Thank you very much. Chair, Your Excellencies, ladies and gentlemen, I'm here on behalf of the Director General of WHO to present the WHO statement to this to the fourth session of the Global Platform for Disaster Risk Reduction. It gives me great pleasure to address the fourth session of the Global Platform for Disaster Risk Reduction on behalf of the World Health Organization. Since we met at the Global Platform in 2011, the health of many millions of people have been affected by emergencies and disasters from all types of hazards. The health effects have included the loss of hundreds of thousands of lives, as well as injuries, illness, disability, and psychological trauma. All of these have long-term effects for people's health and well-being, as well as the education and development prospect of children, families, communities, and countries. We also recognize the progress made by countries and communities to reduce health risks through the development and application of prevention, preparedness, response, and recovery measures. By 2012, more than 130 WHO member states reported having national plans on emergency preparedness, while more than 50 have implemented actions on safer hospitals in 2013. The safety of more than 1,800 hospitals have been assessed. Action is being taken to reduce structural and non-structural vulnerabilities, and measures are ongoing to improve hospital preparedness. Moreover, as at 1st of November 2012, 40 states parties to the International Health Regulation of 2005 have established the necessary core capacities. Member states of WHO have also made high-level policy commitments, such as the World Health Assembly Resolution 64.10 on strengthening national health emergency and disaster management capacity and resilience of health systems in 2011, and the Disaster Risk Management Strategy for Africa in 2012. Given the health imperative for DRR, a much stronger focus on improving health outcomes for people at risk of emergency is still needed. Health partners have identified 10 key messages for consideration by all sectors and actors to enhance the effectiveness of post-2012 framework and to support people's health. These messages include: people's health should be considered as an explicit outcome of post-2012 framework for DRR. Recording of health outcome must go beyond just the numbers of deaths and in future include injury, illness, disability, and long-term health effects. Putting people's needs, priorities, and capacities at the center of action on DRR. These priorities must include health and education. Further emphasis on the all-hazard approach is needed to ensure that the post-2012 framework addresses hazards from all sources, including from communicable diseases and links to other frameworks, such as the International Health Regulations. Greater focus is needed on the work of sectors such as health, which actively manage risk. Multi-sectoral and integrated approaches are also needed. Looking to the future, member states and WHO Secretariat have set a course towards strengthening the capacity of countries aimed at improving health outcomes for people at risk of emergencies and disasters. This includes development of a global framework on emergency risk management for health, technical cooperation for development of country health risk management programs and capacities, and continued support for implementation of the Safer Hospitals Initiative and a global action plan on safe hospitals. Commitment to implement the UN System Plan of Action for Disaster Risk Reduction for Resilience, greater input and participation by health sector in DRR, national, regional, and global forums, including the post-2012 consultations, and support for the multi-sectoral thematic platform on health, which will help to strengthen the collaboration among health and non-health sector for HFA implementation, and the development of the post-2015 framework. In conclusion, our way forward must be collaborative. WHO can assure this community that we will continue to enhance the work with our many partners to strengthen country and community capacities for DRR. Today, we are well placed to seize the momentum created by the discussion on the post-2012 for DRR to put people and their health at the heart of future action on reducing the risk of disasters. Let us together work to protect our society's most precious asset, which are our people. Ladies and gentlemen, thank you very much.
Thank you very much, Mr. Olu, for your statement.